my name is Roshayla, and we're going to do a teaching of cultural competency in nursing. Okay. So after this presentation, you should be able to define cultural competence, explain the importance of cultural competency as a healthcare provider, explain how cultural competency will improve patient outcomes, as well as identify methods to apply to patient care in a clinical setting. So to understand how to provide cultural competent care, we need to know what culture is, and that could be the sum of attitudes, customs, traditions, beliefs, and it's transmitted through language. It could be rituals, institutions, or material objects. So now that we know what culture is, cultural competency, according to Esposito, is the ability to care for patients with diverse values, beliefs, and behaviors, including tailoring health care to meet the patient's social, cultural, and linguistic needs. So why is cultural competency important? Because it allows for equal access to health care. It allows for cost-effective health care. If a person feels that their culture is understood, if they feel like they're respected, they may be more likely to use resources to have like regular screenings or primary care visits, as opposed to waiting until their disease process is so bad that it requires hospitalization. It may also improve patient outcomes. Patients, if they understand what's going on, if they know what resources they have available, they may follow their healthcare regimens. They'll be more willing to participate in their treatment plan, and it'll also build patient-provider trust or rapport. Okay. So how do we provide culturally competent care? Through training like workshops, lectures, seminars, peer education like what we're doing here in this setting, language lines and interpreter services, open, non-judgmental dialogue with the patient, encourage patient participation or input in care, and assess for areas of opportunity. Like we assess how a patient felt their hospital stay was. Then that will also open up areas of opportunity. How can we improve and provide this particular patient population with culturally competent care? And community involvement and collaboration. Like we have that Latino Association, I think it's called, on Beaver Highway. If maybe some healthcare professionals would, collaborate with them, with people who are there who are bilingual and they're able to transmit information. Just get the community involved and let them know what their resources are. Alright, so here's an example of a case study I found on the website Transcultural Nursing. We have a 27-year-old Arab man who refuses to allow a male lab technician to enter his wife's room to draw blood. She has just given birth. The staff finally convinces the husband of the need, and he reluctantly allows the technician in the room. However, he took the precaution of making sure his wife was completely covered. Only her arms stuck out from beneath the covers. So in this situation, we didn't really provide culturally competent care, because if we were educated on Middle Eastern culture, then we know that elders are highly revered. So they may turn to them for wisdom sometimes and advice before they seek traditional medical treatment. Men are not typically involved in the childbirth process. Female modesty is very important, as we saw in the case study. Women are to dress very modestly. Most of them are Muslim, so we know that comes with prayer. They allow meats or no pork. So their meats are from slaughtered animals that are slaughtered according to Islamic tradition. And they're not very tolerant of mental health issues, so you can imagine how this would create a problem for someone in this culture that suffers from mental health, how willing they would be to seek traditional treatment. And family is very important. So now that we understand some components of the Middle Eastern patient's culture, how would we provide better culturally competent care in the case study? We could place a sign on the door that says "not before entering," so that we're preserving the female's modesty. We can only assign female nurses to that patient, and considering this is a pretty female-dominated profession, I don't see why that's not something we could provide for that patient. A female nurse could have drawn the blood for the technician, as opposed to forcing the technician on that patient. We can ask about prayer times and provide signs that they can place on the door for when they want to pray. So those are some of the things that we could have done to provide culturally competent care for the Middle Eastern patient. So that will conclude my presentation. So are there any questions?
No questions.
Okay.
Thank you. Man, you was right on.